getting to clinic and the environments where PrEP is delivered are not always the places that certain communities want to go or would ordinarily go. So we have to upskill people in other areas, whether that's like general practice, whether that's like these new kind of community hubs and settings where people feel like they might have greater privacy or there might be greater normalization of these things. We talk about stigma a lot and how that is still very much a thing. It's still very prevalent, even when we know that when you're on treatment, you equals you. And when we know that HIV isn't a death sentence, all of these things, it still carries that weight and that burden. We still have to keep challenging that all the time. There's also, I guess, provider issues, which I encounter on still a really regular basis. And this is not to say that healthcare professionals aren't often doing amazing jobs, but sometimes time's limited. It's only the obvious things that come to mind. We're so well kind of taught, even within a sexual health sector, to offer even relatively low risk men who are having sex with men PrEP, because, you know, we're like, oh, there's a greater prevalence in this community, that when someone that is particularly Black African descent woman sits in front of us, we often don't even think to ask the question or make the offer. And if you're not offered something, you can't accept it. And it's definitely been under offered. I often sometimes ask colleagues if they thought of it, and they're like, oh, actually, I didn't, and that's a fair point. And we're still having problems with the offering being there. Also, you as an individual recognizing that this is something that you need, and that's an education piece, but it's also, so this is from, you know, personal and also, you know, just wider kind of cultural understanding, being of Nigerian descent. But often people's spouses or partners are abroad, or they're traveling across the continent, and they might be having other partners, and that pushes somebody to be more at risk of contracting a new infection.